My name is Jennifer Turnage, and I am doing my capstone project on VTE prophylaxis in surgical patients. So I have here a group of surgical nurses and technicians, and we are going to go over that. So everybody here, I want you to tell me, like, how do you feel your knowledge is on the subject of clot prevention in surgery?
So, yeah.
Do you feel like, have you ever been given a formal,
No.
education or anything like that?
No.
Just told to put SCDs on.
Mm-hmm.
Yeah.
So, do you feel that you, I won't say put them on right, or do you look
Yes.
look at them? No.
No, there's
Yeah.
like a way to put them on and not put them on, you know.
Yeah, I mean, but as far as just making sure that they fit correctly, do you feel that you know how they're supposed to fit? I mean, any of that, just when you're supposed to make sure that they're on.
I know how I've been told to put them on, but is it actually the correct possible way? Possibly not.
Yeah.
Okay.
No one's actually physically showing me how to put them on.
Or taught you or told you.
Okay. So, first and foremost, what I have right here, I gave you the handout. This is, it's just a questionnaire. And it's an assessment to see what somebody's risk factors would be for developing VTE, venous thromboembolism, or DVT. So, in the first category, you just kind of assign. This is called the Caprini DVT risk score assessment. And the first question, it kind of just goes through certain risk factors that make you more susceptible. Age 41 to 60, how long the surgery is supposed to be, whether or not your patient has visible varicose veins, in a history of IBS or Crohn's, leg swelling or edema, their BMI, overweight patients, obese patients are more risk. History of an MI, congestive heart failure, any type of infection, lung diseases, or restricted mobility. Women have other risk factors such as pregnancy, birth control use, or history of miscarriage. So for the following, there's more, each category you can kind of look through it and you can see each category is kind of assigned more points per thing. You'll see like higher age, 61 to 74, that gets 2 points, 3 points, age 75 or over, and 5 points for these other risk factors, which are like elective hip or knee replacement surgery, broken hip or pelvis or leg, serious trauma, spinal cord injuries, or a stroke. And we will look at this again in just a little bit after we go through some others. So, right now, we have our pre-test, which we're going to have you fill out. It's got some questions. What I want you to do is on the, you start out, you've taken it, and we'll just make another column where you can do it on the back at the end of the presentation, and then you can, we can see like what your beginning score was, and then move on to next. So I'll give you like a minute to do that, and then we'll